Hey, welcome back to RTS Physio. Today is day number 2 in Fix My Knee Week. So yesterday I posted a video on addressing the quadricep muscle and how to increase the flexibility and mobility of that and how that'll improve tracking of the kneecap itself. Today we're going to talk about the hip and the hip mobility and hip strengthening and how that affects the tracking of the kneecap. So the muscles specifically we're going to look at are our adductor muscles, right? So our glute medius and our TFL. Every time you take a step, they keep you from going like this. And if you watch people walk, you can see people who are a little bit weak in these muscles and their hips really come out like this. And then they go like that. And that's a lot of repetition, and that throws off the tracking of your patella, your kneecap, and that can cause a lot of knee pain. So I'm going to move around a lot today in today's video. I'm going to show you a way to mobilize this musculature here. I'm going to show you a way to stretch the musculature, and then finally we'll show you a way to strengthen it. So just bear with me in all the movements. Okay, so I've got my handy dandy friend here again, my foam roller. This one's kind of fancy, but it just really needs to be a pretty firm cylinder to get the job done. So again, I'm going to address a muscle called the glute medius. So this is the big dumb glute muscle. Right about up here is your glute medius, and that's our target for rolling out today. So I'm going to find that musculature, and I'm going to just go back and forth. You'll find the spots, right? If you find a really good spot, you'll know it. And once I find it, then I just kind of oscillate back and forth on it like that. Okay, so once I've got that muscle, and the trigger point's out of that muscle, and I've got some extensibility in it, we're gonna work on a stretch here. So you can do this anywhere. Get a nice firm surface. Let's say this is my knee that hurts. I'm gonna cross this leg over here like this. This may be enough, and we've gone over this in a previous video. This may be enough for you to feel the stretch, right? Just crossing your legs like this. You might be up here like this and getting a big stretch. That's great. Then if you're up here and you're feeling a big stretch in the hip, just apply a little bit of pressure there. Not a lot, just a little bit to kind of increase the stretch. If you're down here like this and you don't feel anything, then you need to lean forward. You keep your chest up, and you bend forward at the waist, and you get a nice stretch of your internal hip rotators there. Right? Hold that for 30 seconds to a minute. Then come up and grab this knee, pull it to the opposite shoulder, and we'll get a nice stretch of the glute max. Okay, so once you've got that muscle sufficiently loosened up, come back over here, and we're gonna do what's considered to be one of the granddaddy physical therapy exercises, the clamshell. Right, you lay on your side, knees bent, keep your feet together and just open up your knees like this, right? It's much more effective if you add a band around your knees, or even just like some sort of weight on top of your legs. Obviously, you might have to hold it in place just to add a little resistance. But this is a great starting point when you have knee pain. You get a lot of extensibility out of this musculature first by rolling it out, stretching it, and then a nice easy exercise here to finish it off. So be on the lookout for my video tomorrow in our Fix My Knee Week.